So do you want to talk about vaginal dryness or should I? Okay, I'll do it. I will talk about the vaginal dryness for you. So hey, I'm Dr. Wendy. I'm a physical therapist. I have taken care of women for 20 years and I talk about vaginas, women's health, and all things all the time. And one of the things that happens postmenopausal, so remember, menopause is 1 year past having periods. So you haven't had a period in a year and your hormones are in the toilet. And this matters because that means your estrogen is exceptionally low. Your vaginal tissue has a lot of estrogen receptors. So when you are postmenopausal and your hormones are in the toilet and rubbishy and horrible, your vaginal tissue will be less plump, will be more dry. So if your doctor prescribes you a low-dose vaginal estrogen cream, and this sounds like you, dryness, pain with intercourse, I'm gonna tell you to take that topical estrogen and use it because your estrogen matters for your vaginal tissue, especially if you have pain with intercourse, dryness, or you notice it's just not quite right. No, it's real. It's a big deal. So in this particular question, I've heard that this dose is so low that it carries no health risk. Do you agree? So topical estrogen applied vaginally is absolutely an effective treatment for, atrophic vaginitis, which means your vagina is dry and dehydrated. Think grape to raisin. I'm not even kidding you. Like, I need you to visually understand that estrogen is a water-loving molecule and keeps things plump. And when your estrogen leaves, you can't keep the moisture the same way. You know, if you're postmenopausal, you have more dry hair, you have more dry skin, and your vagina is dry. But the vagina has tons of estrogen receptors, so it is a very effective treatment. So estrogen loss can lead to a thinning, read that as atrophy, which means shrinkage, of the cells lining the vagina and the urethra. And by the way, the urethra is embedded in your vaginal canal, specifically your anterior vaginal wall, so the front part. So when you apply estrogen internally, vaginally, we want you to put it inside. And that lower third, you can just, it works. Because if you have vaginal dryness, this is what happens. As a result, women may develop vaginal dryness, itching, pain with intercourse, as well as a high risk of urinary and vaginal infections. So, if you have vaginal dryness and you're really unsure about hormones, these are my arguments why a topical estrogen can change your vagina's life. Hit the plus sign and follow for more women's health and wellness tips. Bye.